So Dr. Mary Hughes, an excellent speaker from South Carolina. She's got her own MS center. It's called Premier Neurology. And I'm in the middle of a lot of different things right now. So the name of the program today, we have MS Views Now. This program began at the beginning of COVID. It was to be speaking about COVID-19 when we first began this. My name, for those that don't know, my name is Stuart Schlossman. I have to look at the wording. I have to remember who I am many times. And, it was a long night last night. And, so we just doing our different programs. So those of you that don't know me, I too have multiple sclerosis. I am the president and founder of MS Views and News, and we are the leading MS organization in the United States doing virtual programs. So I wanted to let you all know about that. Today's program is sponsored by Bristol-Myers Squibb, Genentech, and Biogen. Again, we have Dr. Mary Hughes. She's, like I said, an excellent speaker from Premier Neurology in just outside of Greenville, South Carolina. She'll tell you about that in a moment. And again, we're going to be speaking, or not me, but Dr. Hughes will be speaking about the importance of movement with multiple sclerosis. She's going to give you some updates about COVID-19 and what you should know about that with multiple sclerosis and the vaccines. All right. So anyway, let's get this program started, okay? And Dr. Hughes, take it away. Like I said, I'll come back on in about 40 minutes, and we'll see what you've got going for timing, okay?
Okay.
Thank you.
Thank you, Stuart. So good morning, everybody. I have to laugh. I know it's a Saturday, and it was a little dreary this morning, so I appreciate people taking the time to listen in. I want to say thank you to Stuart. I was talking to Dr. Williams yesterday, and we were kind of comparing what was going on in our lives, and I said, Saturday morning, I'm doing another program with Stuart, and we were, and there is information, there's opportunities to be able to talk about things that we don't necessarily have time to cover in the office in exquisite detail with every patient. And I think Stuart, and I really appreciate MS News and Views, MS Now, Views Now, in making these opportunities available. I really think it's been incredibly helpful, and we look forward to seeing each other in person again. But he really has made a difference. And so when Stuart knocks on your door, you say yes, because you want to be part of something really great. So I will tell you from the beginning that whenever I'm asked to talk about movement and the importance of it, I do get a little nervous because I don't always practice what I preach, and I'm always worried that lightning might strike me. I did get out of the bed this morning early and go out and work in my yard. And why? One of the best benefits of exercise is that it helps lift the mood. You know as well as I do, every time you turn on the news, you don't even have to turn on the news. Across my phone came condo collapse in Florida, rising numbers of MS variants, 1 in 3 people in South Carolina vaccinated. What does that mean for the 2 out of 3? It's been a very long year, or has it been 5 years? And one of the things that has been very clear is that movement has been one of the things that has been really affected in the last year. And there's an increasing acknowledgement of that and saying, how do we respond to that? So why do we need to exercise? Well, you need to exercise, same reason I need to exercise. It's good for my heart, it's good for my lungs, it's good for my brain, it's good for risk management. I will confess to putting on almost 40 pounds in the first 6 months of the pandemic last year. Then I realized, looks like this isn't going anywhere anytime soon, but I stress eat. And I wasn't going anywhere. My suitcases, were calling me and saying, like, we haven't been anywhere in a long, long time. I was scared to go anywhere, very cautious. So I wasn't leaving the house. It was kind of work. And even work was different. We weren't seeing patients in the office. We were seeing patients virtually. So when I bought my new sneakers, it was so I could stand comfortably, not because I was walking. And those little changes really have impact for all of us. We've certainly seen this with our seniors who restricted their going out and about. We know that that's not been a good thing for them. We know that, I will tell you, just in my experience with the last year, seeing people virtually, hearing virtually how well they're doing, and then now as we're gradually opening up the doors and trying to bring everybody in that we haven't seen in a year, person face to face, being surprised to see that people are a little bit frailer, a little bit slower moving. Maybe the balance is off a little bit. The phrase "a body in motion stays in motion" has been running through my mind much more than it ever has before. And so what's our commitment to that? I don't like to exercise. I never get the runner's high. I tried the bicycle. I don't really care for that. Definitely during the pandemic, I didn't want to be in a gym with people, the deep breathing, the blowing out. It's really hard to exercise with your mask on. I have reached the point where I'm a woman of a certain age, and it gets a little hot faster, and it certainly gets hot faster when I was wearing a mask. Those are just real challenges. Those are just regular people challenges. And I'm talking to people living with MS. So how has that affected, right? And so we've all heard the analogies. If you have 5 spoons, I like to say if you had $1 and you had to spend more of it on just getting around, you don't have the energy to do other things that you want to enjoy doing. I can tell, really with any neurologic disease, the difference between someone who is exercising and someone who is not. Whether that's Parkinson's disease, where we have really good evidence that with Parkinson's disease, people who really start exercise regimens, we can actually at times start pulling back some of their medications to movement disorder. And a lot of the exercise actually helps with programming the brain, recentering the brain so that they don't require as much medication to move. With MS, I can tell when somebody's been working on their strength, working on their balance, stretching. And I can tell personally, right? Whether that was the infamous 40 pounds, whether that was, boy, it takes me a lot. This turns out Walmart's bigger than I remembered because it's taken me a lot more energy to walk around it. And so moving forward. So one of the challenges now is how do we get people back to where they were, right? For a brief time, it was nice outside. I'm in South Carolina. It is hot. It is muggy. We are hitting the 90s. You can try to get out there early. You can try to get out there at the end of the day, but you're not really wanting to walk in the middle of the day. I actually, during the pandemic, and I still owe my son an apology for this. So for all the years that I told him to get off of YouTube, right? I discovered YouTube during the pandemic. I'm an avid crafter, and I learned how to do a lot of things looking at YouTube, or at least things not to do. YouTube can be very humbling when you compare what you've done, what they've done. It's kind of like the pinchers fail. But I also learned that there's a lot of exercise on YouTube. There's yoga. And in fact, in the office, we very frequently will steer people towards yoga programs or yoga channels that I've at least looked at tried to experience. There are MS Exercise. The MS News and Views is working with a virtual Pilates class, chair aerobics. And so there have been ways to try to be creative about how to maintain our movement or start to regain our level of activity that we had pretty much lost, or at least seen a significant decrease over the pandemic. I think we also don't take it for granted anymore, right? Like I don't take it for granted that I could go to the gym. I'm choosing not to go to the gym. I actually recognize that not being able to go puts it in a whole different perspective. Seeing so much sickness related to COVID or otherwise has made me value my own personal health and know how precious and how not promised it is. As we're seeing people in the office, we are doing a lot of physical therapy referrals. And the plan for physical therapy referral is that when you're done with physical therapy, you're not done with exercise. That when you leave physical therapy, that you leave with a plan. What are you going to do next? So that when you're working with your physical therapist, you're identifying, are there certain exercises I should be doing for my balance? Are there certain exercises I should be doing for stretching? Are there certain strength exercises that I need to be working on? And having that guidance. For those who may not necessarily need to go to physical therapy, but certainly aren't where they used to be or where they want to be, working with a personal trainer. Pretty much the only time I break a sweat in a gym is when I'm working with a personal trainer. I had a secret notion for years that if you break a sweat exercising, you must be doing it wrong. Turns out that's a myth. It's a myth I started, so I apologize for that. But really the importance of continuing to exercise. I touched on one of the health benefits, which was mental wellness. Exercise has really been shown to help with stress management, anxiety, depression. When I'm anxious, I stress eat. Probably a better choice would be to stress walk. And in fact, in the office, sometimes I will go for a walk. I'll suggest to some of my staff members, go for a walk. And there's no question about that's very helpful. And looking at how do you incorporate that into your day. You don't start with a marathon. 5 minutes, 3 times a day gives you the same health benefits as though you did 15 minutes in a row. So you walk before you crawl, you find what you enjoy doing. Gardening is my preferred exercise. And up and down steps, bending, turning, digging, telling my husband what to do. Oh, this is very wearing. Is a great source of exercise, and because I love it, I will do it again. Finding what you enjoy doing is probably one of the most important things. If I say go ride a bike and you hate bikes, probably not going to last. If I say go swim and you're afraid of water, probably not going to last. But finding what you enjoy doing it and making it a priority. Is it Michelle Obama? Actually, I'm blanking on this. I want to give her credit, saying that you need to put yourself on your schedule first. And I'm not very good at that, but I'm certainly good at telling other people that's what they need to do. The saying, like, people say, I don't have time to exercise. I don't have time to eat healthy. Put yourself on the schedule first. I do think that people who take care of the machine do better than those who not. I don't even think I need to say I think the science has proved that over and over and over again, whether it's diabetes or whether it's MS. And the challenge is, how do we incorporate it back into our lives? If it was never there, how do we start? If it used to be there, how do we find our way back to it? And going from that standpoint. So I will be open to talking about that in the question and answer. If there's something that that you have specific requests about or interest about or reasons why you can exercise. Everybody can exercise. The challenge for us is to identify your way. I don't think I can leave this topic without talking about heat management. If you take a normal nerve and you heat it up, it takes longer for the information to travel from point A to point B. If you take a nerve that has already had a change in that conductive coating, demyelination, and you heat it up, the transmission from A to B is going to be even slower. And that's the explanation for why when people are inside and air conditioning, did I mention the air conditioning went out in the office this week? It's been a week. But when they're in air conditioning, they feel fine. And then when they go out in the heat, they start to feel weak, numbness and tingling that's usually not there, becomes more apparent. If they had optic neuritis or visual changes in the eye that they really don't notice most of the time, but when they get hot, it becomes much more apparent. It's because of that impact that the heat is having on those nerves, slowing that conduction. Now, one of the most important points I think is to know is you can't harm yourself, all right? So I don't say avoid exercise. And in fact, that's what people with MS were told to do for many, many years, is don't exercise, don't get yourself overheated. And I'm totally blanking on the name of the downhill Olympic skier, but I'm sure Stuart can help me with that later. But he was an Olympic skier, and he developed MS and was told, sit down. And he did for a while. And he said, you know, if I don't get back out and moving, this is going to kill me. And he was one of the first people to question that. You know, patients questioning physicians. That, oh, well, it does happen, and it should happen more often. But he's one of the first people who started to really looking at, no, he couldn't ski like he used to, but were there ways to adapt his skiing? And so that really is a change from when we used to tell people don't exercise to it should be the mantra. It should be part of your prescription. What are you taking for your disease-modifying treatment if you're appropriate for it? What are you taking for your bladder control if you have bladder control problems? What is your exercise regimen? What is your nutritional status? How are you approaching that? And that really needs to be put on your calendar first before you put all the other things in the day that seem and usually are important to accomplish. Now let's turn to MS and the COVID vaccine. This is a topic that, well, you see, I take a deep breath when I come to MS and COVID. And I kind of challenged Stuart and said, what can I say that hasn't been said already? If 500,000 people dying in the United States in less than a year is not impactful on people making decisions about whether or not they should be vaccinated, what else is there to say? But the reality is, I think there's a lot to say, right? I wish that the vaccination had been rolled out in a different way. I will confess to being one of the people early on in the pandemic. So I don't want any vaccine that's rushed through. I don't want a warp speed vaccination. I want to take your time and make sure it's safe vaccination. And so early when people ask me if there's a vaccine, what are you going to do? I was like, well, let me see. But as the year went on, and as I understood more about a warp speed vaccination and what that actually did or did not mean, I felt much more comfortable about getting the vaccine. And I hope that's my goal today, is to say, what are the things that are standing in your way? And are they myths? Are they misinformation? Because I think that's been really an increasing concern. Living with MS, you know as well as I do, that most physicians get nervous. They're not exactly sure what to do. They're scared that anything that they do may impact your MS. You've all been there. And then throw in a vaccine for COVID and not knowing exactly how to advise about that. The first thing I want to do is say we really need to separate the politics from the science. The coronavirus is not new. Coronavirus has been around for a long time. And in fact, we all know the coronavirus because it's what causes the common cold. Wouldn't it have been nice to have a vaccine to the common cold? I'd have been in line fast. But the reason why we've never had a vaccine to the common cold is because the coronavirus continues to change. It changes its features on its surface that may make it less contagious, more contagious. It changes its feature on the surface of the virus that may make it more of a respiratory versus more of a GI. I mean, it's a constantly changing. It's not unlike the challenge that has come with trying to develop an HIV vaccine. We're certainly much more effective in treating, slowing, some people would say with really good regimens, halting HIV. But we don't have an HIV vaccine, and that's because that virus also continues to change and evolve. So when COVID came out, it wasn't like we had to identify what was the virus. We knew the virus. We had to identify, it's a royal we. I didn't do any of this work, but I'm taking credit for it. So the scientists had to identify what made this virus different, what made it more contagious. Why did so many people have problems with their breathing? And even a big topic now is, what are the long-term consequences of having COVID? So warp speed was a bit of a misnomer. It's a virus that's been very well characterized for a long time. And what was needed to happen quickly was to adapt to this form of the virus and then develop safe and effective vaccinations. So warp speed, I think that was unfortunate terminology. The second is the blame game. I meet many people who are nervous about getting the vaccine. And it's not because they're anti-vaxxers or they're uneducated or they just don't know, right? It's because people are trying to make very complex decisions in a very confusing conversation. I mean, we don't spend this time talking about the vaccinations for flu. Can you tell me what form of your flu vaccine you got? I can't tell you what the form was I got. I want to say Fluzone, but I don't even know if that's right. All right. I don't know anything about that. I haven't had to worry about that. But suddenly we're thrust into this world about different vaccinations and what's potential complications and this. And we heard new words. So for my patients, they hear me say quite often, I'm not a real doctor. I don't keep up on a daily basis how vaccines are developed. I do know that we have well established in the field of MS that people who get, for example, the flu vaccine are a much lower risk of having a relapse than getting the flu. We know viral infections is a risk factor for having a relapse with MS. We've known that for years. We have also seen that the benefits of routine vaccinations. We know that, and except in very exceptional circumstances, that the inactivated viruses, the not live viruses, are safe, and that we try to avoid the live vaccines. Well, now, I think it was 2-3 years ago, I thought Africa was on sale because I had multiple patients who were coming in and saying, we're going for a trip to Africa, and there's a list of recommended vaccines. Well, if you're going to an area that is endemic, which is a lot of yellow fever, and the recommendation is that you get the yellow fever vaccine, I think that one's a live one. We're going to use it as an example. I suggest you get the yellow fever vaccine. Now, if you're living in South Carolina or New York or anywhere in states, and the question comes up, should you get the yellow fever vaccine? No. What's the likelihood you're going to get exposed to it? What's the benefits of getting it? And, what's the relative risk? COVID's different. COVID, as far as it's not a yellow fever, COVID is here. COVID hasn't gone anywhere. You turn on the news and you look over at what happened to in India. What is happening in India? It's not over. What's happening in South America? In January, late January, we started seeing that the Delta variant of the COVID is here in South Carolina. It is now the number one cause for hospitalizations with people getting COVID. The original form of the virus, the alpha virus, was the one that we were really facing last year. What's significant about the Delta variant? Science would suggest it's at least twice as contagious, spreads very rapidly, and unfortunately may have even more complications, higher death rate, higher long-term complications. In April, the Academy of Neurology meeting is held, and this year it was virtual, and every other topic, I don't think I'm exaggerating, maybe 1 in 3, but every other topic had the word COVID in it. Migraine and COVID, stroke and COVID, fatigue and COVID, cognitive challenges in people who've had COVID, long hauler syndrome, people who've been exposed to the virus who yet haven't recovered yet, and the debate about whether we need to start preparing for people who've had COVID who may have long-term symptoms. I don't think I hope we've moved past the period of time where people, it's just like getting, it's just like getting the flu. I had COVID. I had it at the same time another employee, a friend of mine in the office got it. I was out for 10 days. It was not a mild illness, although on the scale, because I was not hospitalized, I would have been considered a mild case of COVID. It's one of the most miserable experiences I've had for a long time, and I have to laugh because you know how sick you are when even after we passed the 10 days of contagiousness, and I said to my husband, I said, I don't think we have to wear our mask anymore. My husband gave it a few more days, all right, and slept on the couch a little longer. He didn't want it, and he had good reason not to want it. My husband is male. He is of a certain age, over 60. I don't think he's listening, so we can say he might have one or two medical problems. He is not obese. Let me make sure I put that in there. But he is in the age group that has the highest risk for complications from COVID. It was reported on the news, the regular people news. You don't have to go to the science journals to see this, that the United States life expectancy was cut by a year last year. For Hispanics, it was cut by 3. For African Americans, it was cut by almost 2. Our life expectancy was cut by 2 years because of a virus that really started causing problems a year ago. The biggest the biggest takeaway for me to that is that there is something I can do about it. Right? I can put on my seatbelt. I know, get in a car, there's a good chance, statistically, that I'm going to have a car accident. And I don't want to be injured. And the seatbelt has been shown to give me that additional layer of protection. And so I don't know if I'm going to be in a car accident today. I may never be in a car accident, but I wear my seatbelt. And that gives me a certain amount of comfort when I see others driving crazy on the road that you can't predict. I want you to put your seatbelt on. I know the heartbreak of hearing how many people have been impacted by COVID, it still rings in my ears. It's still happening. It is not over. Let's talk about the vaccine. I said, so what can I tell them about the vaccine that they haven't heard? But let me talk about what I was concerned about. So a vector versus an mRNA, the new science, new technology, I had to go back to the drawing board and kind of remind myself, what were these different types of vaccines? So the first was a vector. Well, I'm familiar with a vector. A vector vaccine is where they take a piece of the actual virus and they code it, give it to the body, and the body says, what? That's not normal, reacts, and is ready if it ever sees it again. All right? Flu vaccine is a vector vaccine. They try to choose what are the most likely variants of the flu are we going to see. They expose us with very low doses of it. Our body reacts because it's not supposed to be there. And then if we get exposed to it again, our body already has this level of protection that it's built so that we hopefully can not have such serious consequences with the flu. The vector vaccine, mRNA. Ooh, that sounds a lot like DNA. And I don't want any DNA or mRNA. I don't want anybody messing with my DNA. Those are all valid concerns if you don't completely understand the science. And I think that's one other thing, is that sometimes new and shiny ain't always the best. We can be cautious about saying, the 2021 model of the Audi, I don't know, why am I saying Audi? I drive a Honda. Okay, the 2021 model of the Honda Accord, let somebody else drive it for a year before we figure out are there going to be any problems with the engine? Are there going to be any, I don't know, electrical problems, right? Let them figure it out for a year before I get the new model of a car. But the mRNA really makes a lot of sense when you understand what mRNA does. mRNA, messenger RNA, is the recipe for the virus. It is not the virus. So the vector, we take a little piece of it, they do their magic, they give you this very low dose of the virus, your body responds. But instead of having a piece, the messenger RNA, the mRNA, gets the recipe for that virus. And then you're given the recipe. Now, I was thinking about it in terms of sci-fi. You're given the recipe in invisible ink that is dissolving in front of you. Because you get the recipe, but then it's gone. It only lasts in your system for so long. So if you don't read, if you don't read the secret message, you can't bring it back. It's not giving you the virus. It's not affecting your DNA, but it's giving your body direction on how to develop it. If that helps somebody else understand it, certainly that reminder to myself that it wasn't inserting itself into the DNA. It wasn't changing anything in my body. It wasn't giving me the actual virus in a different way. Helped me make the decision about getting vaccinated. What's the right vaccine? That's the other one. Well, which one did you take? I took the first one that was available to me. What's the right vaccine for you? The first one that's available to you. There is multiple consensus groups, scientists, neurologists have come together and looked at the data, and there is no specific recommendation for one vaccine over another. The nice thing about it is that there are now 3, and that people can make their individual choices, but the best vaccine is the one you have in you. If you don't have it, hurry up. Will the vaccine make my MS worse? No. There's no evidence for that. We know viral infections can trigger a relapse for MS, but there's been extensive vaccination data that suggests no, it doesn't put people at a higher risk for a relapse. When I get the flu vaccine, I get a sore arm. I usually feel a little grungy for a day. That's me. I don't have MS. I usually tell people if it lasts me a day, it might last you a day or two. It may last you 2 or 3 days, but it's worth it. When I got my vaccine, I did react, and it didn't feel so good. But what I kept telling myself all the way through it is at least I'm allowed to fuss about it. And the peace of mind, the way I've been able to move forward with my life in a very different perspective has been why. Even when I was going, my husband kind of said, well, maybe you need to go lay down. And I got halfway down the hallway, and then I started thinking about all the things that might be safe for me to do. And I turned around and said, can I take a woodworking class? And he kind of said, go lay down. But I started feeling the world open up around us. Then it got confusing, right? I had my vaccine. We were supposed to be still wearing our mask. Why were we wearing our mask? The reason why we were wearing masks was not because we weren't protected, right? Keeping in mind if it's Pfizer or Moderna, you really need to get both. If you just do one, the protection is very minimal. You need to get both courses of the vaccine. The Johnson & Johnson, of course, is a one-time vaccine. But it takes about 2 weeks, 2 to 3 weeks before you get the full benefit of getting the vaccination. And so I've had my vaccine. Why am I wearing a mask? Because the science wasn't at the point then that, okay, I'm protected, but how do we know that I can't carry it and give it to you? And that's where there was that delay between, yes, you're vaccinated, now you can take your mask off. So now I say I wear my mask out of love for you. I also wear my mask because there is a surging variants. The encouraging news right now is it appears that the vaccinations we have are going to be protective against the variants. That's very reassuring. Will we have to get a booster? I get a flu shot every year. I get a tetanus shot booster every 5 years, and sooner if I touch something. That just comes with the territory. I don't think there's anything special to the fact that we need to get a COVID vaccine booster. Other myths. I had a patient that I saw actually yesterday, and she was vaccinated. Some of the medications, the disease-modifying treatments, we do try to time if we can, right? In fact, early on when the vaccinations came out, there were recommendations, well, you need to try this and that, but you know as well as I do that we can't just go out and get a vaccine. There's shortage of vaccines. There's not one now, so there's not a good excuse not to be able to get one. But there were long waits to get the vaccine, so the right answer was get the vaccine, right? Near and present danger, is that a movie or something? I don't know where that came from. Near and present danger was COVID. Get your vaccine. But she'd had her vaccine, and she'd had it 6 weeks before, and she'd gotten her infusion, and she was concerned that the vaccine was not going to be as protective. And I'm glad she said that to me because it never would have crossed my mind. We want the vaccination to have the best opportunity for protection, which is why there are conversations about, should you do it the day after this, or can we try to wait? But it's not that your medication will decrease, if you're dosed later, that it's going to decrease the effectiveness of the vaccination you already had. All right. And sometimes, to give you an example, like in people who've had bone marrow transplants, sometimes they have to have all their vaccines given again because their body doesn't remember that they've had them before. We don't have to do that with the COVID vaccine. Okay, with our disease-modifying treatments, we do not have to go back and revaccinate people. You don't lose the memory of the vaccines that you've had already. If there is some science that would suggest that if I get a vaccine and someone you get a vaccine and you're taking a disease-modifying treatment, not all of them, but a couple of them, that I may get a more robust response. So say I get a 10, Stuart, I'm talking, and on disease-modifying treatment, you might get a 5, but a 5 is still protective, all right? So it may decrease how effective, how robust, but it doesn't really matter if you're a 10 or a 5, you have protection against the COVID, all right? And so that's the other data that I would point out that says, you should get your vaccinations. All right, I saw Stuart give me the hint. So Stuart, I'll pause, and if you're ready to start giving me some of the questions or question me yourself, which is always a scarier option. Be happy to go there.
Quite interesting listening to you. Thank you for your dialogue today. That I think that a lot of people, wow, huge thunder above me. I wonder if anybody even heard that.
I told you when I talk about exercise, thunder and lightning happens, but yeah.
You can talk about thunder and lightning only if you're outside. You'll get good exercise from that. Trying to get back inside, right? All right. So firstly, I do want to thank you for all the kudos that you were giving me on and off during this thing. It was very nice to hear that. It's greatly appreciated when the doctors, the neurologists in the community know about all the work that, we're doing to provide and get people informed with and from people like you. So the name of the person that you couldn't come up with for the Jimmy Huerta.
Of course. Yeah. Or Hugo, for those of us who don't know how to say it. People have heard it as Hugo.
Jimmy Huega, Huega, right. All right. So he had an MS organization. He's from just north of the Denver area. He's an Olympic skier, I believe, and he has multiple sclerosis. He started that organization to help create movement. And since that time, though, it's changed. And so when I say the name of the organization that they became, many of you will say, yeah, I know that. That was a big one. So, okay. So we're shutting off the electricity behind me because it seems to be drawing the lightning, all right? All right, so, and we don't want a power outage from that. All right, so anyway, Can Do Can Do MS is what this became. All right. So they do a tremendous amount of work similarly to what MS Views and News does for patient programs, but they do, they're doing a tremendous amount in the Colorado area. This is not a blackout. Obviously, I'm still here. All right. We're just limiting what's going on outside because evidently the lightning knows that I'm here and it wants to light me up. Okay. All right. First question I have for you. We did get a lot, so I just want to go through these different things. Firstly, can you please re-explain what the mRNA is? I did hear you speaking about it, but somebody just wanted to know, like, specifically, what does it stand for?
Okay.
So
it stands for messenger RNA, and the messenger is the key. And I like really the analogy, it's the recipe, right? And then so you get the recipe, your body is given instructions on how to respond, what it needs to develop to protect itself against this virus, rather than getting the actual virus. And then the other thing is when people worry about it being part of their system, is it's written in disappearing ink, because the mRNA only stays in your system for a very short period of time. If you don't get cooking, the recipe's gone. All right, so we don't have to worry about, is the mRNA going to stay in our system and do any interesting things down the road?
Okay, thank you for that. Now, next one is, we're going to switch back and forth. So there are people that were asking questions online, and I have plenty of them in my hands already. I don't know if I'm going to say this name right, but Jada, Jada, yeah, that is a different name. I maybe shouldn't have said it, but she or he, I guess she would like to know, how does exercise help MS fatigue?
So that's a great question. And whenever I recommend exercise, if someone says, I'm really fatigued, and I say, what's your exercise regimen? They're always convinced that I wasn't listening to them, right? Didn't you just hear me say I'm tired? And then you asked me about exercise. And so all I can really tell you is that the science, there have been multiple studies to try to prove this point, right? And there have been multiple studies that have tried to look at, are some exercise regimens more effective than others? And so you've seen the yoga exercise. I know you guys feature the virtual Pilates program, bicycling, routine, kind of what you think about, like the strength, weightlifting and those kind of things, all right? But the common denominator is that exercise, whatever form it's taking, actually does have an impact on your endurance. It's the same reason why we tell people with heart disease to exercise, right? You would think that's a group we'd say, go sit down. Your heart really can't handle all this. We do it in supervised ways. We do the same thing in pulmonary disease, right? Is that the exercise, and to even try to talk about all the ways exercise affects the body. I'm not a real doctor, so I get to pass. But so I think about it as an endurance. I think about it as the release of those endorphins that help with the mood. And so I am listening when someone tells me I'm really tired or fatigued, and I ask them, what's your exercise regimen? I heard you. Now, that's never the one people want, though. They want a pill. I want a pill, actually. But until then.
Okay, thank you. Helene is asking, what's your advice for people on Ocrevus and how patients should behave after the vaccination?
Well, so how should you behave after the vaccination? Yeah, I can take that a couple of ways. So on people on Ocrevus, we try, if it's possible, to wait or to get the vaccine in maybe the last month to 6 weeks before their next infusion. And if it's possible, to wait for 3 months after the Ocrevus infusion, theoretically. But every organization, National MS Society's consensus statement, sometimes we have in life, oh, isn't that nice? If we could just say 3 months and we'll get you a 2 o'clock appointment, but that means we've left you exposed to the risk of COVID for, 4 or 5 months? So the answer is to get it as soon as possible. And the newer guidelines have even gotten even more emphatic about the need to, if you have a choice and you're like, well, my next infusion's in August, should I go ahead and get vaccinated now? The answer is yes. All right. If you don't have a choice and it's you're due for your Ocrevus in a week, perhaps you can push that back 2 weeks and go ahead and get your vaccination. All right. So it's individual. Definitely, you want to talk to your healthcare provider. You want to talk to. That brings up another point. Unfortunately, a lot of what I'm hearing that patients are being told is not accurate from their primary care physicians or their general neurologist. And that has added to the confusion. As you well know, when you're living with MS, you make people nervous. They don't understand this MS thing. They know it's something with your immune system. And I'm not being, don't ask me how to manage your diabetes, right? I don't keep up with that. I can tell you what the TV commercials say, but I have not recently reviewed the most up-to-date management, the most up-to-date guidelines. And this really is an area, I think, that the benefits of seeing someone who specializes in MS has clear benefits, all right? Attending these programs to be able to go and maybe question in an informed way some of the myths that are out there. And so I get it. I have patients this week that I felt really bad about what recommendations they got. Their recommendations were wrong, and hopefully that will alleviate the fear of getting the vaccination.
So the person that asked the question wrote again that she meant to say how cautious you should be after vaccination if you're on Ocrevus.
Yeah. So I don't think your rules are any different from mine, all right? In the first 3 weeks after Ocrevus, I always caution my patients to be, if somebody's sick, you shouldn't be around them. You want to wash your hands. I mean, I think you just take a little additional precautions when we know that the most impact on your immune system is in those few weeks after you've had your infusion. I'm not wearing my mask today, but I have one in my purse. I have one in my car. I carry one with me all the time because I'm aware of these other variants out here. I still avoid crowds. I still eat outside. And so I think those are the precautions that we should all be taking. And with MS, I think I don't want you to live in fear, but I want you to live in caution. And I think that's what's really fair. In South Carolina, 1 in 3. When I go in the grocery store and I don't know who's wearing a mask because they're vaccinated or because they are not vaccinated. Okay. So I'm cautious. I think it's appropriate to be cautious.
Thank you for that. So I'm going to switch to outside of COVID. I'm going to bounce back and forth just to keep it exciting. All right. And we're going to get into a question about activity. How much is too much activity? When is strenuous goes beyond? And I'm going to combine it with somebody else's question about, because it goes so well together, is the Peloton too much for an MS patient?
So the Peloton would be too much for me right now because I hadn't been exercising, right? And so I need to build up to being able to be on the Peloton and do the rapid bicycling, right? You walk before you run. So the most important question when you're talking about an exercise regimen is, what is your current fitness? What are your current challenges, right? We don't want you to get injured and lose your ability and push yourself further back. This conversation around you need to have 5,000 steps a day, 10,000 steps a day, 50,000 steps a day. If it takes you more than a day to recover from your exercise regimen, right, it's probably too much. And if you're not sure, because our own insight sometimes, because we're so motivated to do it, we may need to ask somebody else, do you think I'm exercising too much? If you're having injuries, if it's taking you several days to recover from your last regimen, if you hadn't been on a bike, perhaps you don't try biking uphill on the Peloton, all right? And so it really depends on where you are And if appropriate combinations, so say you have a foot drop, there are straps that can help hold the foot on the bike, but you probably want to do that with somebody who can supervise how that's going and what speed you're at before you just try it the first time.
Right. Okay, thank you. All right, Nick is asking, when are you seeing patients again in Greer at your office?
We are. We quickly turned to virtual yesterday when our air conditioning went out, but we are gradually opening up the door. We're still cautious because not everybody's vaccinated. And so I have the utmost concern about the safety of my patients. And when you come in the office, and healthcare facilities, I think it's a very important point. Healthcare facilities, you are still recommended that you wear a mask. And so we have a little different rules. But yes, we are opening, we've been seeing people, but we're transitioning from virtual to in office as much as we can. And let's face it, I don't think virtual's going anywhere, right? I mean, there's a lot of conveniences with virtual. So I think we're going to be looking at a hybrid model, not just in the field of MS, but across healthcare in general. If I just need a refill, I too don't want to go drive to my doctor's office, sit in the waiting room, wait and say, could you just refill this? Otherwise I'm fine. And then, yeah. So I think there's going to be a real change in healthcare and how we deliver it.
Okay, thank you. All right, Yolanda is, if I get loud, it's only because the rain is so loud on the roof up here that I have to speak louder, okay? So Yolanda's asking or saying, they say that because of how Ocrevus affects the B cross, the vaccine won't be effective if you don't follow the 4 months after last infusion, at least 4 weeks before the next infusion. So timing's the key issue. So can you expand upon that, please?
Yeah, so I have, so neurologists' social lives tend to be slightly suspicious sometimes. And I have spent more evenings on conference calls with other neurologists who specialize in MS, debating these issues. We have the guidelines that came from the National MS Society that, can I be quoted saying, I thought the first set were kind of wussy. And then the second set really came, I mean, they just kind of went through all this and then said, but you should get your vaccine. If COVID didn't kill, if this was toe fungus, then yes, I would say wait 4 months and we try to perfect it. This isn't toe fungus, all right? And so that's where I think the urgency of being protected versus the theoretical best time. If I could predict when you were going to get COVID, then of course we would do it right on time, but that's not how life works. So that's the real bottom line is when you can get it. If it's a difference of a week or two, I'm fine with it. If it's a difference of months, I'm not fine with it.
Okay, so Yvette is asking, for those that are living like in hot climates, what do you suggest for a length of time to be walking, like on the street or whatever? Is there,
so that's such an individual question, actually, right? Because because we all have different heat tolerances, and I'm putting me in there because as a woman of a certain age, I don't walk for. So I don't think the question so much is how long should you be walking in the heat. Is if you are heat sensitive, are there ways we can adapt your walking regimen? So should you walk earlier? Should you walk later? We know that bringing the body temperature down, whether that's a cooling vest, those Frogger towels. Turns out nobody likes being hot. So I send a lot of people to Lowe's or Home Depot to get those towels, to get the gaiters. You can get masks to decrease the temperature. What can we do to have your to keep your comfort? And I know for every person who says that they're heat sensitive, there's somebody in the back saying, what about me? I'm cold sensitive. So it really is a very individual. No, it was a woman that asked the question, right? So I can say, use your common sense. All right. If you walk, did you catch that, Stuart?
It was a guy. Wait a second. I'm really I really don't know what you're going to say
I don't
about
have to
that.
cross that bridge. I just want to see if you're paying attention. But if you walk and you get to the corner and you can't get back home, you walk too far. All right. And if you're crawling in your front yard, you walk too far. I don't know why. I think there is a superwoman syndrome that happens with MS, right? Nobody else is out walking at noon. And there are my people living with MS who are like, I'm walking at noon. I'm not going to let the heat stop me. You don't get any extra points. What can we do to really help facilitate that?
So what do we say when we're talking about swimming? All right, so swimming and pool water in hot areas easily gets to 90 degrees.
Right.
And how is that? What is that doing to the body? You know, it's like as bad as being in a hot tub. So what do you suggest people for that?
So the first thing I think is very important to know is if you get overheated, right? And some people that might be at 70 degrees, some people that's at 90 degrees. You are not harming yourself. You're not further injuring the myelin. Right? That's, I think, the first thing to say. But if you can find a pool that is cooler, that certainly is preferred. So when we're looking at the why, I say look for a lap pool. Do not look for the arthritis pool, because for arthritis, you want a warm pool to help loosen up those joints. People who are real swimmers, I don't know what the term is, professional swimmers, avid swimmers, the lap pools are not heated, or not heated as much, all right? And so those are some of the things to just kind of keep aware. At one point, I'm sure I knew what the ideal body temperature water was for the thing. But the realistic is trying to find it, and check when you're checking the temperature of the pool. Do that with somebody with you, all right? Because we don't want you to find that you get in the hot pool and you're so weak you can't climb out. That's the safety concern with it, okay? And so as you're finding out what your temperature range is, what you can tolerate, what you cannot tolerate it, do that in a safe manner.
It's easier to find out if they have a thermometer in the pool.
I don't own a pool. I'm in South Carolina. We don't have as many pools as Florida.
That would be the intelligent thing to do first. So if they have a thermometer in the pool, but you know, that's a guy's talking hardware. Yeah. Okay. All right. So we have several more questions. One is which are they any closer to determining if and when we will need a booster vaccine for COVID?
So I think, I guess at this point, it has not, as they're actively following people who've gotten the vaccinations and looking to see how long is the vaccination effective, there has not been a significant wearing off for people who've been vaccinated that would suggest we need a booster. So that is actively being monitored as we speak. For people who've had COVID, and yes, you do have some initial protection, but it's essentially gone in under 3 months. And how do we know that? It's because people were monitored who had COVID and looked for evidence that their body still had antibodies against the COVID. So at this point, we're doing good. If you've been vaccinated, there are no recommendations for a booster now. Is it possible? Yes. And I think, and it's going to be dependent on, is there another variant that we don't know about that we may not, the vaccines we currently have may not have protected against? Is our vaccine going to wear off? We get to get flu vaccine every year, right? Because it doesn't last for 5 years. So that's all a moving target. And I think it's part of the challenge, right? And this has been a year of flexibility, adapting, trying to operate in a world of so much uncertainty. What I focus on more in my own thought process is that thank goodness there are people who are monitoring this, who got the COVID vaccine in the trials, who are ahead of me in how long they've had their vaccination. So we'll have this information from those volunteers before I will need it.
Okay. I don't know if you just mentioned it, but what about a booster, though, for people that are using immune suppressed medications?
Yeah. So that's a tricky one. That came up not too often, not too long ago. I had a patient who got his vaccinations and got his went and had antibody testing done, and it came back negative. The problem with this is those tests are so awful, right? I mean, the COVID vaccine, the COVID test, the traditional put it up your nose test, swab your nose, depending on the test, was only about 50% accurate. So if you tested negative, you could still have COVID. If you tested positive, well, you had it, but if you tested negative, that didn't mean you didn't have it. And that's the challenge with these antibody tests, is how accurate are they? If it tests that they found the antibodies, you've got antibodies. If you test that you don't have the antibodies, that doesn't necessarily mean that you don't have the protection, all right? And so in lieu of our ability to really be effective in answering that question, until that evidence comes along, we don't recommend a booster. Now, can I confess to making a mistake myself? So I had COVID. I tested negative, but I don't know what else gives you a fever of 102 and shortness of breath and sweat, So there was no need to test again because I had every symptom. But I did test negative the first time. And then I was in a hurry to get the vaccine. So they do recommend that you wait. I think it's 90 days, right? And so I wasn't waiting around any 90 days. I went closer to maybe a month. And so when I took the COVID vaccine, I essentially was taking a booster, and then I boosted it again 2 weeks later. All right.
Wow.
Now I understand the recommendation to wait. All right.
Right.
And so that's where we don't want to be getting boosters when we don't need them. If the body is already has a response, getting another booster when it's still very active can cause a lot of side effects and not necessarily any known benefits.
Okay, thank you for that. What can you tell us about the long haulers?
So we believe in the long haulers. That's the first thing, right? And there are long hauler clinics where people are being actively followed. What is a long hauler? A long hauler is someone who continues to have certain symptoms even though it's been a relatively long time. So I think the line in the sand right now is about 3 months. All right. All of this is fluid. All of this is still but people are proposing the language of if it's 3 months later and you're still having significant problems with fatigue, is this cognitive, right? So fatigue, cognitive. We know that people who have had COVID do get disrupted sleep patterns. That has been shown. You can do people's sleep studies and show the differences. And there's been some consequences of COVID that we didn't know to look for. So if someone had COVID and they had a headache, and trust me, I had a headache, we weren't automatically checking to see could that person have had an embolic stroke or head clot, right? Now, when we see people months after their actual COVID, and they're coming in saying their headaches may be a bit better, but they're much worse than they were before COVID, and we go back and do the CT or the MRI, preferably the MRI, we have been surprised multiple times in seeing that, oh my goodness, you had a blood clot, and we're several months out from that. So there is an increased recognition, and that's why the Academy of Neurology, every other conference, every other conversation. I was actually just looking at a brochure for a Harvard neurology review, and one of their big topics is the long-term consequences of COVID. So unfortunately, it is something that we are figuring out. That brings me to something else, though, Stuart. I think the other thing is we hear these alerts, for example, Guillain-Barré, right? That people who get vaccines that are higher risk of Guillain-Barré. And people will ask me, how do you know that is not a higher risk with this vaccine? there's always been a very small risk of an autoimmune response to vaccine. The government keeps a vaccine fund for that. The small risk is 100% risk if it's you. I completely acknowledge that, all right? But like everything else in life, we're taking the risk and the benefit. And I think the challenge is to put the risk where it needs to be versus the benefit. Sometimes we, watch TV commercials and then they say, and you could have stroke, death. I'm like, who the heck would take the medicine, right? We don't do a good job of balancing that. So I think it was Academy of Neurology, again, or maybe it was New England Journal of Medicine, had an article just recently that talked about coincidence and causality. So there is a baseline number of people who get Guillain-Barré every year. We know that it tends to be more often in the fall. I can describe it. We know there's a baseline. During the COVID pandemic, was there an increase in the number of people who got Guillain-Barré? And in the era since we've been vaccinating people, is there a spike in Guillain-Barré? And that has not been seen at this point, okay? And so somebody out there who has Guillain-Barré? Yes, because Guillain-Barré happens all the time. There's a baseline level of how often it happens. So how often is it a coincidence versus a causality? And I think that's the challenge when people are talking about risk and benefits. And I heard somebody had, people have these things happen. Are they more common than they should be based on non-COVID situations?
So for those that don't know, Guillain-Barré is another condition similar to MS, but not quite, because it only attacks the peripheral nervous system. And those of us with MS, are only attacked for concerning the central nervous system, right? So coincidentally, I know a tremendous amount about Guillain-Barré, not because I chose to study it, but because my father had it back in the early 90s and still carries the effects of it to this day, for how bad he had it. So I'm not going to get into all that. I mean, if you want to speak to me about that privately, I will. But it's just totally different than multiple sclerosis. But yeah, so I've been following that whole thing, obviously for him, to do with COVID as well. So yes, but there's no increased Guillain-Barré because of COVID. All right, so unless they took off their masks and they went running around and went into hot spots of where there was a lot of COVID happening, then I guess they would have a better increase of having COVID, right? Okay.
We're not 100% protected, yes.
Right, so another question that came up, I didn't quite follow what she texted me, was person wanted to know, because she forgot already, did Dr. Hughes speak about the COVID variants that keep popping up? They are harder to treat and basically worse than COVID-19. So how would that be affected by these vaccines? And I know you spoke about the Delta variant, which probably we don't know. There's more that we don't know about it than do know about it, right?
Well, so this time last year, I had the same comfort in being able to say, we can learn from Europe. We can learn from India. We can learn from South America, right? Because they're experiencing it before we are experiencing it. I did mention it. I think one of the challenges, and Stuart, I try not to encourage people to do it by trying to scare them to death, right? I mean, I think that's been kind of one of the approaches that's been tried, is like, if you don't get the, and be able to do it from a position of informed information and be able to make a good choice individually. And I do respect that. But the challenge is, why, yes, the variants are rising. January 2021 was when Delta was first seen. I can remember seeing it when it was 3 states, 5 states. Now it's essentially, I think, 49 out of 50 states. From the experience in India, experience in South America, it does appear to be more contagious, which is pretty impressive, because COVID-19 was pretty contagious. The Alpha variant was pretty contagious. So to be more contagious, and unfortunately appears to be more likely to have severe complications. So who's getting COVID now? Well, the highest risk of the highest numbers of people who are getting COVID are people who are not vaccinated. They tend to be younger people, right? So 20s, 30s, 40s. A year ago, we were saying these people, they do fine, and they bounce back really good, but we're worried about grandma. Unfortunately, the greatest number of people who are in the hospital right now are these people who are in their 20s, 30s, 40s, the younger groups that we thought would be more immune to it. And so we're seeing that the Delta virus, we're starting to see the numbers rise, starting to see more cases in the hospital of it. And that's why it's good to know that the vaccinations, I know Pfizer has made that statement. Moderna is made the same way. So we would hope that we'd be just as protected, whether it was Pfizer or Moderna. I think the jury is, I don't think the final answer is in for Johnson & Johnson, but we know you're more protected than if you didn't get the vaccine, right? So that's why I'm wearing my mask. In situations where I'm in crowds, where I not as necessarily comfortable around me, I still wear it.
So I was listening to a report from one of the top immunologists in the country, not Fauci, who was discussing how they believe that in January of this year, we might have the same rate of COVID, of 2022, yes. We may have the same rate as COVID as we did in January of 2021 with all those that are not yet vaccinated. Yes. Now, though, when you're talking about the Delta variant and you're talking about how bad it is in South America or in India, how do we make that comparison, though, with the United States when there's far more vaccinated in the U.S. than outside the country?
So far more is a relative term. Less than 50% of us have had, in the United States, have had both vaccinations, right? Or, as completed the vaccination as appropriate. South Carolina, 1 in 3 has gotten the COVID vaccine. That means 2/3 of this state has not gotten the COVID vaccine. So even in the reality is, we don't want to hear that it's not over. Oh, I don't want to hear it, but it's not gone. Even when in the office, when we're talking about flexing up and letting people come into the office, we need to see them, right? It's never ideal to see somebody only by virtual. But as we're flexing up, the skills that we've learned from last year, we will be just as fast able to flex down, right? We took down some of the shields, not all of them, the plastic shields that were protecting, but I didn't throw them away. I just pushed them to the side. And I think so. That is something that we're going to have to contend with. Very unpopular. I don't think anybody wants to start talking about mandates for wearing masks and those kind of things. But the reality is, and so that unless something is done differently, what has taken the alpha variant of COVID down is the number of vaccinated, right? And those of us who are vaccinated are also protected at some extent from the Delta. The risk is because there's a lot of people walking around who have not gotten the vaccine, and it's going to spread. And right. So, if 70% of the state hasn't been vaccinated, well, 70% of the state is very susceptible, and particularly for a more contagious. We may see the second surge may be much worse than the first surge. And that's a very hard thing to say or even acknowledge.
Right. And this country definitely cannot afford another financial shutdown when we're spending more than we already have. So, that could be a major problem. That's why people do need to get vaccinated. So for all those that are online right now that have not been vaccinated, you've now heard why you should get vaccinated. So, and I do hope that you do get online, and the lines are not long like they once were. Another question. People of color in the South, primarily in the South, are not getting vaccinated. All right. And we're talking about South Carolina, North Carolina, Alabama, Georgia, Is this a reason why there is so much concern with the variants in these states? Is there a way to
I want to separate why. I think it's a slippery slope and a dangerous slope. I want to separate why people of color may be more reluctant to get a vaccine than not. All right. Okay. One is there's a general mistrust of the health system, and to be quite honest, it's well earned. All right. It's not really, I mean, MS has shown it, diabetes has shown it, heart disease has shown it. We have a long history where we've not had equitable care. Even during COVID, who was more likely to be hospitalized, who was more likely to be discharged, who was a lot more likely to get the antibody, who was not recommended the antibody. So you've heard a lot about discrepancy in equities in healthcare. So it's understandable. It is understandable. The history of being experimented upon, all right? Tuskegee experiments, our lifetime, right? It ended in our lifetime. So it's always in the back of people's minds. And so I think there's a very healthy concern and mistrust. And it's going to take more than a rock star getting there. Well, I guess we don't do rock stars. Okay, it would take more than a rhythm and blues singer getting a vaccine to say, get the vaccine, right? I mean, I posted my vaccine online. I seriously doubt that anybody was like, I wasn't going to get it, but then I saw Dr. Hughes had hers, and so I got mine. But we really need to be able to explain what we know and what we don't know about the vaccine, explain the mechanisms of how when's the last time we said mRNA? Okay, this is not part of our day-to-day language. It's not like anybody knew what an mRNA was. We all kind of remember it was something back in high school, didn't we talk about it? But so these are all terms. And then the other is separating there's a lot that's gone on in the last year, right? The Black Lives Matter movement, the really recognition front and center that there are discrepancies. So there's a fairness to that, but there is also we need to be given the opportunity to ask our questions, have it explained. So I mentioned I don't want to have people doing it out of shame or so you must be an anti-vaxxer. When you have good questions, right? But how do we make it available? And how do we also ease the minds of people who may have a little bit of different concern about a vaccine, anything injected, than someone who's not had that historical experience?
Okay. Next question from online. Thank you for those answers, by the way. Next question online. And before I ask the question, I want to let everybody else know if you have questions to ask about what we're speaking about right now or anything that we just mentioned to do with movement and exercise or whatnot, even about symptoms. Now's the time to ask because we're not going to be on here in probably another.
Okay.
All right. Right. Okay. So and the thundering is starting again, so we're going to have to shut down the lighting again soon too.
All right. South Carolina.
So the next thing, it's not really a question, but Yolanda writes, and Yolanda's by you also, and Yolanda writes, too many people believe the vaccine has a chip in it or believe it will negatively permanently change your DNA. There are more crazy thoughts out there. And before the doctor gives her answer, I want to give mine. Do you all carry a cell phone? If you think that's tracking in your cell phones, all right, forget the damn chip. Forget the chip. It's already there. It's on your side, in your purse. However you carry that cell phone, it's there. And yes, that is an MS logo on my phone. All right. So, yeah, I mean, you're already being tracked. You got GPS in your car. You're being tracked. You go through the downtown area and you see all those cameras everywhere. Yeah, they see your license plate. You're being tracked. All right. So forget about the chip. You're being tracked already.
Yeah. So, okay, Stuart. Where did that come from? We heard that each vaccine was identified, that each vaccine had a chip on the bottle. So there were chips involved with the conversation, right? Because I can today, if I had a problem from it, they could track it all the way back to the bottle that I got my vaccine out of, all the way back to where it was manufactured, all the way back. All right. So there was a lot of conversation about chips, right? And I saw FedEx showing how they could monitor the chips. It's not like we don't microchip dogs and cats and cows and horses. So microchipping is not necessarily so bizarre. It's really not as science fiction, and it is an injection. And so I can see what I think about as being the perfect storm, right? That all of this, in any myth, there's usually a few grains of truth. I was very honest early on. I was like, I don't know about getting a vaccine. I'm gonna wait and see how y'all do first, but then people kept dying, right? And then I actually had the opportunity to hear multiple explanations of the mRNA, right? I went back to school. I'm not a real doctor. We don't talk about mRNA every day. I had to go back and understand what it did and what it didn't do. And Stuart, to this conversation, I bring some training, right? So it didn't take as much for me to understand what mRNA is. I had to refresh versus somebody who may not have heard about it for years. Well, yeah. And forever, if possible. And so, and the conversations about this were not, just to say, how was this rolled out? So I'm very sorry. I think a big problem of it was how it was rolled out in the first place. Okay. How it was rolled out in the first place. There was so much political, social unease, finger pointing, you're an anti-vaxxer, you're a wimp if you wear a mask shame, right? What are you still doing to wearing a mask? You're not tough enough. You're not gonna make me wear a mask. There's so much that has swirled around the vaccines. And that's not necessarily just a people of color conversation, okay? But I do think because we are unfortunately also much higher risk for dying from it, remember? So everybody lost a year. African Americans lost almost 2. Hispanics lost 3 off their life expectancy last year. And we're not done yet, right? So we really have to be able to tailor these conversations, to have these conversations, to try to level the playing field so that we can leave some of the emotion at the door so we can really have a conversation that's meaningful and informative, right?
Yes, thank you for that. Just a few questions remain, okay? And first one is from a person named Laura. I have MS. I was fully vaccinated, Moderna, on April 16th. I was diagnosed with COVID in May. I'm recovering very slowly. What do we know about recovery from COVID and MS? Laura, as I just read, was diagnosed with the MS after she had gotten her vaccine. So she's got a lot of concern here.
Yeah, so I think that's fair. So Laura, there's a lot I don't know about you and would be inappropriate for me to learn during this program. But here's the things that come to my mind first. Is very rarely when somebody gets diagnosed with MS, did it start the day before, right? That there's usually evidence that they've had symptoms of MS before. And whatever brought you to attention is what triggered the diagnosis, but you probably were living with it for a longer period of time. By definition, multiple sclerosis is multiple neurologic events separated over time and throughout the body. So that's the first thing. The second is you gave a very good example of, while it is relatively rare, the fact that the vaccine, even though you're vaccinated, the second, hopefully it was after your first vaccine or the second vaccine, is it takes time for the vaccine to kick in. That's why we still are supposed to be wearing our masks 2 to 3 weeks after we get our vaccine, because we're not fully protected, right? That's the argument against people saying, well, I'm just going to get one. I'm not going to get the second one. Laura would tell you to get both, all right? Because you can still get COVID. No vaccine's 100%. Now, the other question is, we know that the risk from a relapse is higher from a virus than the vaccine. So which one was the cause? Which one brought you to attention? There's a lot of questions with that. Now, do people with MS take longer to recover from COVID? People with MS, if you ask me, take longer to recover from everything, to be quite honest. If I say I get a cold, I'm going to bounce back in a day or two. It might take somebody with MS, not everybody, right? Because it's a very individual disease, but it might take somebody else 3 to 4 days to really get back to. We talk about anesthesia. I might be awake and ready to go in 30 minutes. It might take you an hour and a half to be really felt. I didn't say don't get anesthesia. You get all the anesthesia you need to get, but to build that into your expectations for recovery. If it's April, May, June, July, you do not yet meet criteria for long hauler. And I think one of the things we really know is we sort of underestimated what the recovery time. So to say 4 or 6 weeks after you had COVID, that you're still having symptoms. A lot of the symptoms with MS can also, like, is the fatigue related to the COVID or is the fatigue related to the MS? It sounds like you've been busy. That's my medical term for this. Like, couldn't you do one thing at a time?
What? I have to cut you off for 1 second. Sorry, I messed up. I read her question wrong.
Oh, okay.
No, your answer was great. I read her question. I said she was diagnosed with MS in May. Actually, she said she got COVID diagnosed in May, 1 month after getting her vaccine. All right. But your answer was great for anybody that might be in that situation anyway.
Okay. But yeah. And so that's one of the things, and I don't know which vaccine you got. And so none of them are 100%, right? I wish it was 100% for getting COVID. Even when we look at the Johnson & Johnson vaccine, what gets a little tricky is what are you talking about when you're looking at the effectiveness? So it was a 100%, 99% reduction in hospitalizations. But that didn't mean people didn't get COVID. So they were more likely to get milder disease. So I wish, that's why, I still have masks all over the place, right? Because I know that I'm not 100% protected against it. And with the uncertainty of the other variants becoming more prevalent, I don't think I'm going to be putting my mask away for a long time. Something as simple as this, Stuart. I was getting ready for this. I've just gotten in the habit of just doing my eye makeup. And I was like, wait, they're going to be able to see the rest of my face. I had to go find some lipstick.
Very good. So I was telling somebody earlier today, somebody in the hotel that I was staying that she's like, oh, I don't have any more masks left. And I said, well, come to the trunk of my car. I have about 200 in there. They're there. And when I don't need them, then I will donate them to a hospital. But meanwhile, I'll have as many as I want to have. All right. So Laura continues with another thing here. She says, my concern is how to gauge the recovery, which is very, very slow since her getting the COVID in May.
Mm-hmm. So May. I think I mentioned that the proposed language for long hauler is someone who has symptoms over 3 months. So you're still very early, although it sure seems like a long time. I can tell you, and I don't have MS. And 6 weeks, and I still think that maybe I still have some symptoms from it. All right. So it is a gradual recovery. The real question you're asking is this going to be permanent, right? And I think that's the ultimate concern is, I'd like this to get over faster, but is this a permanent consequence? And we don't know the answer to that yet, all right? Because we know that, and we have other examples of post-viral syndromes that may take months for people to really recover from. So the brain, and the brain is a very special organ. It does have an incredible ability to heal itself, but it also sometimes takes longer than, say, if you broke your arm. I'm not recommending breaking your arm, but it's a complex process.
Have you heard anything about African American women getting bumps on their skin after the vaccine? I'm asking because I was asked to ask.
Yeah. So at
Like
the
everything else.
vaccination site, I think that's a great question because, yeah, there's been a lot of conversation about skin reactions right after the vaccine, right? So after the first one, people have a lot of redness or skin changes. Does that mean you shouldn't get your second COVID vaccine? And the answer is that is not a reason not to get your second COVID vaccine. All right. And so, yes, that has been reported. And it's one of those things that, you know, at the beginning, not enough people had it. People were like, no, I never heard of that. Now I'm like, oh, yeah, it happens. I've heard about it. I've seen it. It happens. But I think the bigger question's already been answered. Does that mean you shouldn't get another one? And you obviously want to talk to your primary care physician. Not me. I'm not a real doctor. But the recommendation, as I understand it best, is that it is not a contraindication. Unless you have a major allergic reaction, which is very, very rare with the COVID vaccine, it is safe to get the second vaccine, even if you had some bumps or irritation at your injection site.
Okay, thank you for that answer. And next we have Karen. Karen is asking, can COVID Moderna vaccine cause brain swelling, head swelling for people with MS?
I am not aware of any data that would suggest that's a concern. So maybe I always try to think like, where is this coming from? So so one of the rare complications after a vaccine is something called acute disseminated encephalomyelitis. And so people will have a vaccine or have one episode of, you see it a lot in kids, ADEM, you may have recognized that, where they'll have just a diffuse demyelinating event. We usually think it's a viral trigger. And with edema, you can have edema, but it is self-limited. So that would be a very rare reaction to the vaccine. I've not heard that specifically as a concern for the COVID vaccine, but that is certainly, I can't say it would never happen, but we can say is highly, highly unlikely.
Okay,
So
thank you for that.
I know what you're talking about, the context, yeah. Mm-hmm.
Thank you for that. For everybody on here that do not know about COVID-MS, this is something that was set up by the Consortium of Multiple Sclerosis, the National MS Society, and another organization. I don't remember who at this moment. But if you go to COVID, COVIMS.org, okay, you can look up different things that people have been reporting that have been happening to them, and the answers that the team from COVID-MS are replying. So this is all, it's a registry, and everybody that has multiple sclerosis and has gotten COVID have been asked to go there and, you know, sign in and let them know what's going on with you. So that way they can start tracking it and putting it together. And this will benefit, you know, somebody else, maybe, hopefully not in a year from now. Hopefully we'll get rid of this, but I doubt it. So hopefully your reporting to them could help somebody else later on. Okay.
And Stuart, that's what we appreciate when I say we can look over in London, we can look over in Europe, Italy, those registries informed us quite a bit and very valuable to us to be able to say what to expect, what to prepare for, what treatments should we be using, should we be concerned about the disease modifying treatment. So registries have been very valuable, and I certainly would encourage people to participate.
Okay, so I want to let everybody else know that, you know, we got like one or two questions now remaining. Number one, my fear of getting the vaccine was tremendous at the beginning, and I think I doped myself up in order to go get my vaccine, and I wanted to be dopey for the next few days. But I realized a month and two later, and even today, I looked behind me to see if a tail is growing. It's still not there. All right, and I do tell a lot of people this. So, you know, I'm not concerned with it. I am not concerned with the tracking. Again, my phone is my tracking to the world. And I probably should be more afraid of all these UFO sightings that they're having right now than anything else, right? You know, we have to stay vigilant. I mean, that's what the doctor is basically saying, you know, with the mask wearing, with everything else, social distancing. So MS Views and News is now providing in-person educational programs again. We will continue to do these virtuals, but we are now getting back into providing the virtual programs. And we insist upon social distancing at these programs. We have the tables far apart from each other. Instead of seating 10 people at a table, we're seating 4 or 6 at the most. We are requiring that people that are not vaccinated yet to come in wearing a mask. There's no way for me to really know. I cannot ask for your vaccine passport. But, you know, we have to, you know, just hope that people are being honest in what they are doing. And the few programs we have had people coming in wearing masks, and that's great. You know, I just said thank you to them. Mm-hmm. So that's all we can really do with that. I also want to let people know that Monday night we have our new yoga class starting. If you don't know anything about it, go to our website, msvn.org, and it's right there on the page, right? The homepage has all of our events that are coming up for the next several weeks. And yoga's there, Pilates is there. Get signed up for these classes. There's no cost to you. And you do not have to move around. It's chair yoga. It's chair Pilates. All right. So maybe for the yoga, you might need a mat, but you could do it from your chair as well. All right. And we have other things coming up. Starting on Wednesday, we have a new series coming up on mental wellness, and that's with Jessica Thomas from North Carolina. She's a licensed clinical social worker, and she will be doing this series for us. She was graciously happy when I asked her if she would be the leader of this program, because I select people who I know who are best for our programs. That's why Mary's here, because I know she's one of the top people to have, right? When I say Mary, I mean Dr. Hughes.
Flattering.
I'm sorry I said your first name instead of your doctor name, Dr. Hughes, all right? But okay. Yeah, you know, we select people to speak at our programs because we need people who best can relate to the patients, and not that they're just speaking from a textbook. So as you heard with Dr. Hughes speaking today, she's talking a lot about, you know, even with the movement and how she was affected by this, the COVID, how she was affected by this. And that's a great way for you all to learn from it, is hearing from somebody that is just as affected by, you know, what's going on. And we don't want stonewalls talking at our programs. So Jessica Thomas was selected to speak for the mental wellness series. And then after that, we're at the end of the month already. So starting for July, we have a slew of programs coming up. Again, if you go to our website, you can see everything that's happening there. Our in-person program coming up in July will be at the end of the month in Jackson, Mississippi. So if you live within 100 miles of Jackson, Mississippi, I really hope to see you there. It is truly, we are the only MS organization providing now live in-person programs again. And 2 weeks ago, we were in Columbus, Ohio. Again, we will be in Jackson, Mississippi. In the beginning of August, we'll be in Roanoke, Virginia. And the middle of August will be by Dr. Hughes. We'll be in Greenville, South Carolina. All right. And then just to go a little bit further, September we'll be in Atlanta, Georgia, and just north of Detroit, Michigan. In October, we'll be in Franklin, Tennessee, and we will be in South Florida. We have our MS Symposium, which will be live, and we have so much space. We have almost 8,000 square feet to put 150 people. So for all those that are on here from South Florida, we will be doing that again, live and virtual. So every one of our live programs will also be virtual, or also now called hybrid. All right, so we will get larger audiences for this. Okay, so that's all the gossip that I wanted to have about MS Views and News, but I just want to let everybody know about that. A person just wrote in, do I have to include my name in CoVMS? I don't know. And really, what's the difference? Seriously, I mean, make up a name. If you don't want to use your real name, you know, make up something else and just put it in there. I mean, that's the best way to do it. Call yourself Aloysius Gediddlehopper. I'll tell you how to spell it, but you have to write to me directly. All right. So, you know, Dr. Hughes, the only thing remaining is that for people with fear about COVID and who don't want to gain 40 pounds, they can still exercise. And I know that, you were talking about this earlier. I didn't know if you got into the aspect of going for walks around their neighborhood, or if they live in a building, or if in a home, they could take 40 laps around their property, just do something. Yes.
Yes, I mean and really recognizing that you can break it up, right? If you do 5 minutes and 5 minutes and 5 minutes, it's as good as you did 15 minutes in a row. And give yourself grace. Just because you can't be where you wanted to be today doesn't mean you can't work towards it. And yeah, I'm off the wagon right now, but I plan to restart the walking. But it's okay. That's just called being human. But part of it is the responsibility to get back on the wagon and to really figure out how to do it.
Okay, thank you for that. All right, I'm done with all of our questions. How's that? We combined a few of them. We made it a little bit easier. Dr. Hughes, I want to thank you again and again and again for all the time that you give for the MS Views and News programs. I do want to thank all of our attendees for being online with us today. I hope you can share with your friends what they missed. All right. But please do know that we are video recording, of course, like we do with all of our programs. And this will be up on our YouTube channel, which is youtube.com/MS Views and News. And more easily, you can just go to the website and click on the YouTube button from the website, and you'll find this on our website by the middle of the upcoming week. Okay. And then you can look at it again. You can share it with your group members or whomever else, your family and friends, and show them why they should be getting vaccinated, okay, and why they should be masked and why they should be doing exercise. And after that, again, Dr. Hughes, thank you again, and I'm going to say have a great day.
All right, you do the same. Be safe down there, Stuart. I'm going to go out into our sunny South Carolina.
You do that. I'm going out into a storm. Okay. Have a good one, everybody. Be safe.
Yes, thank you.
Bye-bye.